listening to the Pharmacy Podcast Network.
Adverse drug reactions, or ADRs, are a serious issue in healthcare today. The pharmacist is the last line of defense to help prevent ADRs. A rising role of the pharmacist is the specialist who focuses on our children. Pediatric pharmacy ensures safe and effective drug use and optimal medication therapy outcomes in children up to 18 years of age. Currently, there are more than 1,450 board-certified pediatric pharmacy specialists, known as BPS. If you're interested in this expanding field of pharmacy, this podcast is for you. All right, everyone, let's give it up for our host.
Hey, listeners, welcome back to the Pediatric Pharmacist Review. I am one of your co-hosts, Justin Cole, and today, Mary Vong is back with me. Mary, how are you doing?
I'm doing well. It's a beautiful day, and I'm super excited for our guests because I feel like we have a really fun topic.
We do, and you've got, I think, some personal connections with some of them, which is really fun. Well, today we are going to be talking about pediatric poison prevention and the role that poison control centers play in caring for the young people among us. And we've got a rock star group of guests with us today. We have Nikki McElroy with us, Lauren Longo, and Anthony Jaworski, and all have various paths that they've taken to be in the clinical tox space and to work with poison control centers. So I'm excited to learn from each of them today. So let's do this. Let's have them each introduce themselves and their role and maybe a bit about how they ended up in clinical toxicology or poison control. So Anthony, let's start with you.
Sure. My name is Anthony Jaworski. I'm the clinical program manager here at the Poison Control Center at the Children's Hospital of Philadelphia. My background is as an emergency medicine pharmacist. I graduated residency first at Henry Ford Hospital back in 2014, and then I did my critical care residency in West Virginia University. And after working in the emergency medicine field for a few years, I uprooted, moved to Philadelphia, and tried this poison control center thing a try. And I've been at the Philadelphia Poison Center since 2019, really engaged in not just management of toxicological emergencies, but also in epidemiology, studying these big data sets and kind of seeing big picture in the world of toxicology.
Great. We're excited to have you here on the podcast. Let's go to Nikki next. Nikki, could you introduce yourself?
Yes, thank you again for having us. My name is Nikki. I'm currently a pediatric emergency medicine clinical pharmacist at Holtz Children's Hospital in Miami, Florida. I've had a long-standing interest in toxicology. So as a student, that's where I discovered my passion in the setting of pediatrics. So I pursued pharmacy residency in pediatrics. So I did my years at Children's Hospital, Philadelphia. And that's where I met Anthony and Lauren. So I did some rotations with the Poison Center, learning more and more about toxicology. And then after residency, I did a fellowship in clinical toxicology in Atlanta, Georgia. And so currently, I still work with Anthony and Lauren with the Philadelphia Poison Control Center, helping take calls and assess patients.
Can I just throw that both Nikki and I passed our tox boards in the same year, 2023, so yay.
We did.
Well, that's not a small feat, so congratulations to you both. So let's go to Lauren. Lauren, could you introduce yourself?
Absolutely. And I can't resist saying I think the fact that Anthony and Nikki passed their tox boards makes them diplomats. I think there's a fun title that goes along with that I'm sure they can get into if the audience is interested. But hi, I'm Lauren Longo. I'm the Associate Director of Advocacy and Communication for the Center for Public Health Readiness and Response at Children's Hospital of Philadelphia. We house a variety of public health programs, including the Philadelphia Poison Center, which Anthony and Nikki touched on, but we serve about 9 million people in eastern Pennsylvania and the state of Delaware as their HRSA designated poison control center. My background is in public health. I completed a Master of Public Health degree. After that, went down to the NIH and completed a health communication fellowship, and didn't think that I would end up in the world of toxicology. But when I saw this job posting, thought it was such a cool opportunity as a public health practitioner to be able to collaborate closely with nurses and pharmacists and physician experts in in work that really serves our community and really challenges us to think about ways to change health behavior. So basically, I just geeked out about the opportunity, and 6 years later, I'm still loving it every day. So yeah, thanks so much for having us.
We're super excited to have you like three. I think it's so cool. Like when I met Nikki, I was just like, wait, what? You did a PGY1, a PGY2, and then a Tox fellowship. Like it's kind of unheard of and it's a very untraditional path. So kind of going off script here, but for Anthony and Nikki, like what was that journey like? Like what made you motivated to take that extra year of training and then to go through and get your DABAT, your DABAT?
I mean, for me, like I alluded to, I've just been passionate about toxicology since the moment I learned about it. And so it was a little bit of a long haul, but, my whole year of fellowship, there wasn't a single day where it felt like work. I loved every moment of it. I got to learn so much. And so for me, it was just worth it. And I genuinely enjoyed it. And then, Anthony can talk a little bit more about ABAT, but it's also interesting. Anthony and I worked together when I was a resident, so he taught me a lot of what I know as well. And then getting to sit for boards together was a really cool experience.
Yeah, definitely. Nikki and I both took like different approaches to eventually credentialing and sitting for the exam for the tox boards. With my pathway that I took, my initial interest in emergency medicine, actually, back when I did residency, there was not too many emergency medicine residency programs. There were mostly crit care, and that was your way into that field. And then toxicology was such a small component of that curriculum. But as I worked in the emergency department and seeing all these tox emergencies coming in, I got to learn about the whole process of really becoming a clinical toxicologist. And that credentialing took, I want to say, almost 7, 8 years for me to be able to do that. So there are different pathways to achieve that, whether it's through the fellowship pathway, which is a pathway that, Nikki, you took and was a nice direct pathway, or if you've graduated from, a PGY2 program, you could do it over the course of a couple of years as long as you work toward, your toxicological expertise, and it's, so my process and my route was even more non-traditional, I think, in that capacity.
Well, one of the unique things is that you both have pediatrics experience. And so I want to contextualize the work of poison control centers in relation to the kids that we care for. I've always found it interesting that many of the poison control centers in the United States are actually attached to or housed under the umbrella of pediatric hospitals. But of course, that doesn't mean they surface just pediatric patients. I mean, you guys are taking calls from providers, from parents, from patients who could be 1 day old to 109 years old, right? So maybe could one of you contextualize for us how many of the calls that poison control centers receive are for pediatric patients? Is that a majority of your patients, or is it a different percentage? Maybe, Lauren, is that something you could speak to?
I'm happy to kick us off. So yeah, speaking specifically about our experience in Philadelphia, about just over 50% of our calls are actually concerning kids age 0 to, I guess, the 0 to under 6 population. When you add in the 6 to 19-year-olds, you're looking at, Anthony, I think it's safe to say, about 75% of our calls. So yeah, it's absolutely a resounding majority. And of course, probably a majority just when we look at that toddler age cohort themselves. But you hit the nail on the head, Justin. We like to say we serve people from cradle to grave, and I guess even before cradle with when in the womb as well. But yes, so the vast majority are concerning kids, and especially that toddler cohort as well.
Yeah, and I'll add to that, when you look at the national data for calls coming into the poison centers, it's roughly the same, 40% involving your toddler age group, 20% involving your pre-adolescents and adolescents, and another 40% involving adults. So it almost looks, when you look at the data, that yes, poisonings do span a whole life and affect all age groups. But when you adjust for population, definitely the pediatrics accounts for a much higher burden. And I want to throw in a little bit of poison center and toxicology history for you guys a little bit, just to kind of give you a little bit of perspective of why this is such an important pediatric topic. Way back in the day, I'm talking like the 1950s, one of the top causes of pediatric mortality was poisoning. It was poisoning due to various agents, a lot of them, back then pharmaceuticals, but also caustics and, things you would find around the home, which really, called for kind of like a standardized approach to managing and, this vulnerable age group. So the first poison center started in Chicago, and it was actually a pharmacist who made his personal phone available on a 24/7 basis. I'm not sure how he did that because there were no cell phones back then, so he was either glued to his home or his office. And he created the first index of all substances and how they were poisonous. He had like over 9,000 index cards of consumer products that had like toxins, and information. Only a year later, he teamed up with a physician and they actually opened up the first formal poison center. This was back in 1953. And since then, a lot of hospitals, especially pediatric health systems, did engage in poison center-like activities. And, as the years went on and, after a while, we saw the Poisoning Prevention Act of 1970 come out, and we saw a drastic decrease in pediatric fatalities due to poisoning. So one of the greatest success stories, I think, in pediatrics over the last half century. And again, kind of highlights how important of a topic it is in this particular population.
Super interesting, and honestly, like that is probably one of the biggest ER visits that we have. Usually, it's like asthma, and then like some sort of a poisoning. So what does a typical day at the poison, or night actually, does a typical day or night as a poison control center look like?
Yeah, so it definitely can vary by time of day. I will say, usually in the late evening hours around 11 p.m. to 1 a.m. is usually when we get the peak of hospital calls. So those are usually ER physicians, ER nurses, sometimes ER pharmacists as well, calling into the poison center, presenting a case that just arrived, a case that maybe they've worked through a lot of differentials and they still don't know, what's afflicting the patient. So they want toxicologist input. So I would say that's when we get the peak of the hospital calls. And then through the overnight hours, it's a little quieter from the home front. So that's when we get a lot of follow-up done on our currently admitted patients that we're following longitudinally. And then in the early morning hours, usually around 5, 6, 7 a.m., that's when I personally start to get a lot of accidental double dose calls. Patients, they wake up early in the morning, maybe earlier than usual. They take their first dose, fall back asleep, wake up, forgot they took it, and take it again. And so they call in for guidance with that. And then kind of throughout the morning and the afternoon, it's a lot of home calls. So these can be children, toddlers, like we talked about, getting into things around the home, parents concerned they may be mismeasured acetaminophen, ibuprofen, an antibiotic they take. So it is interesting how the time of day affects the acuity of cases, the types of cases that we get. And in general, per day, the Philadelphia Poison Center gets about 160 to 230 calls. So we're quite busy.
Yeah, and the interesting thing is it's a very interdisciplinary team that works together too. We're pharmacists here. Lauren has a history, as an MPH, a public health background, but we have nurses that work within our department. So it's one of the more interdisciplinary areas in healthcare that I've encountered, in practice.
Yeah, I agree fully. I was actually going to jump in and ask the question about interprofessional practice and teammates that are involved. Of course, I think you'll often have PhD toxicologists that are part of poison control centers as well. So you've got a lot of different people. You've kind of already talked about this, Nikki, but I'd love to dive a little bit further. What types of calls do you receive most frequently regarding children and poisonings or exposures? Are we talking acetaminophen as a high one? Are there other drugs or different things that you see most often?
Yeah, and it can also vary with age. You have to think, developmentally, is the patient crawling? Are they just starting to explore putting things in their mouth? Are they mimicking what parents and other people in the home are doing with medications or products? So in kids, usually like less than 5 years, we see a lot of cleaning substances that children get into. They're playing in the kitchen, they open the cabinet, and maybe they're playing with the bottle. Same goes for cosmetics and personal care products. Again, that goes back to children mimicking what the adults in their life do. Analgesics certainly can be of concern, like I alluded to, acetaminophen, ibuprofen, whether it's mismeasuring or because these suspensions are usually flavored and taste good. Sometimes kids will just take the bottle and take a gulp of it. We also can see foreign body ingestions. Maybe they swallowed a small toy or a piece of something. And then kind of the older the child gets into older childhood, adolescence, that's when we start to see more medication ingestion. So again, analgesics are very common, but also just their prescription medications that are in the home. And so, yeah, it kind of depends on the age, just in terms of common things we see.
And then I'm going to flip to something a little bit more surprising. So what are some more surprising or lesser known poisoning risks that children have around the house? Because I know, like, according to all the reports, it's always like acetaminophen is number one, but what are other culprits that we should look out for?
One thing that parents may not think about, and I'm speaking specifically to parents of, infants, first-time parents, they might not think about water toxicity. Infants less than 6 months of age should really not be consuming water. They should be exclusively breastfed or formula fed, just because they have immature kidney function. And so they are not able to effectively eliminate free water, and it can dangerously lower their sodium levels, and they can get pretty sick. And so, that's something that when I was a PICU pharmacist, I had patients in the PICU with water toxicity, and it can be very scary. And I would say that's not really common knowledge. So, really just looking to pediatricians for guidance on when it's safe to introduce water and how much they should be drinking as well.
I can add to that, there are so many of these kind of like lesser known risks, and I have a situational one that's not necessarily tied to particular poisons or anything like that. But we always think about, and we'll get into poisoning prevention and all that kind of stuff. And new parents, they do a great job of locking all the cabinets and making sure the medications are up and away, without thinking sometimes about the people visiting the home, right? And we get so many calls about the situation where you have either a family member coming for Christmas, grandparents, right? Grandparents are very important in the upbringing of our children. But along with them, they bring their medications, right? And they're not always up to the standards that we want for poisoning prevention. So this scenario is actually a very common one that always flies under people's radars. Medications are kept in purses in the guest room, right? And then the child walks in and grabs the glipizide and takes a dose, and other medications that could be extremely harmful. So this is a situation that, I think we encounter all the time, especially around the holidays, that does put the children at risk.
Lauren, do you have anything to add regarding some of the most surprising or lesser known poisoning risks?
Absolutely. And this one, I'm not sure if it'll feel surprising or not, but just might be something that people don't think about as much. And that's iron-containing multivitamins. Vitamins are a really common call at our poison control center, especially think of things like gummy vitamins that are on the counter. It's not rare for us to get a call that a child ate an entire container of gummy vitamins, which thankfully oftentimes is actually not too concerning. However, something that I'll let Nikki and Anthony speak to is just the risks of iron in small bodies. And because vitamins aren't governed under the auspice of the FDA, they're not required to be in child-resistant containers. So especially for parents of small children, I would recommend that when you're shopping for something like a prenatal vitamin or iron and you have small children to look and make sure that you're actually buying something that has that's in a child resistant container, because companies can opt in to do that, but they don't have to do that. So that's a specific concerning risk. And then when you think about the population that might be taking prenatal vitamins, they might have other very small children and kind of be in that age cohort that is more likely to poison themselves. So Anthony and Nikki either Anthony or Nikki could speak a little bit more in depth as to the specific risks of iron in small bodies.
Yeah, so iron, fortunately in recent years, recent decades, thankfully we've seen a decline in significant iron poisoning in pediatric patients. Like Anthony had alluded to earlier, poisonings used to be a leading cause of death in children, and it actually was iron that was the culprit. And so that's what led to legislation that dictated how over-the-counter products need to be packaged, specifically iron needing to be in blister packs so that it was difficult to get multiple tablets out at a time. But like Lauren mentioned, multivitamins are kind of this special loophole, for lack of better words, where it's a product that has a whole lot of things, including iron, and so they don't fall under those same regulations. So I will say iron toxicity can present with a lot of different symptoms. The first thing we usually see is a lot of GI upset, which can be difficult to tease out if we don't know how much is ingested, because if you've ever taken iron supplements, you might know that it can be upsetting to the stomach, even with just a therapeutic dose. But really the important things for us on the Poison Center side when triaging the level of toxicity or lack of toxicity we're expecting is knowing how much iron is in the product. And so parents, if you're listening, healthcare providers, if you're listening, it's so critical that we have that bottle, in front of you so you can read us the ingredients. And so the iron is typically expressed in elemental iron. It might say iron, parentheses, as ferrous fumarate, the salt, 18 milligrams. So that is so helpful for us to know, to do some calculations with how much your child weighs so we can see what the iron load is and what we can expect and what we need to do.
Well, those are great insights. So I want to shift a little bit and talk about common household poisons. So first, a quick story. Back in the early 1990s, I had an uncle who was going to pharmacy school. And I remember going to his graduation, and one of the things he gave me was this whole long group of Mr. Yuck stickers. And at the time, Mr. Yuck was one of those ideas that you would go and put these bright green and black stickers on pretty poisons, essentially, in the home that kids were supposed to then avoid. Now, looking back, maybe marginally or not successful of a project when we look at those stickers. But it just reminds me of this idea that our household poisons can be common exposures as well. So can you guys speak to some of those common household poisons that put children at risk, and what are some good ways that parents and caregivers can prevent accidental exposure aside from Mr. Yuck stickers?
I can take a stab at start taking a stab at this one, and then Nikki and Lauren, you guys can fill in. When I think about the household poisons, especially that have been linked to like the highest morbidity in the last couple of decades, I first think about like the single unit laundry dose packs, like brand name Tide Pod, right? And Tide Pods, they revolutionized the way we do laundry, but unfortunately there was the collateral, and that was children, where they were attracted to these products. They were colorful, fun to play with, right, squishy, and then of course they put them in their mouths, bite down on it, and then aspirate on the liquid. And a lot of children early on developed ARDS, acute respiratory distress syndrome, following these ingestions. So over time, time, these ingestions were followed, and consumer product safety and other entities really worked on with the company to improve safety standards around that. And one of the most important ones is actually, surprisingly, keeping these products in their original containers. Lauren, I think you were telling me, and you could probably tell me a little bit more about this, about you can go to Target and purchase these containers that are see-through, and that you could put Tide Pods into or something like that.
Social media has created some really interesting behaviors for people of all ages. We think about kids' social media challenges, but there are absolutely corners of social media where people create these very aesthetically pleasing laundry setups, and they actually showcase how they purchase their laundry detergent packs and their scent boosters and all sorts of supplies, and put them in very pretty clear containers just so they have a very pretty laundry room. So that's something that absolutely gives us heart palpitations, and it's such a shame. And I think that it's a good use case for why we talk about the importance of products being up, away, out of sight, and out of mind for kids is something that we add as well, because kids are really creative. If they know something exists, even if it's up, away, and out of sight, they'll come up with creative ways to get it. We get calls where kids, they'll use a chair to stand on a counter, to stand on something else, to reach something. So we want to think about even keeping it out of mind. And I think when we take something that was packaged in a boring container with maybe a child-resistant pack, which Tide now does, which is fabulous, and remove it and put it into a new package that is not child-resistant, that's and maybe even attractive to kids, that's a really scary behavior for sure. But yeah, really interesting case with the laundry detergent packs for sure.
I'm definitely a culprit of that. I'm a big fan of the pretty jars. Luckily, there are no children around here to get into the jars, and the jars contain matcha and espresso. No Tide Pods here. So luckily, we're squared away on this forefront. So talking about Tide Pods, talking about water and things, I'm just interested in knowing, what is the craziest thing you've ever seen someone overdose or become poisoned with at the hospital? I remember if there was some sort of an event happening in Miami, if it was Art Basel weekend or Ultra, we would have LSD. Those were really fun to manage, very interesting, lots of learnings from that. But what are the craziest things you all have seen in the Philadelphia Poison Control Center? Anthony's hand is on his face, so I'm excited to hear.
Loaded question. Yeah, I mean, I feel like every day there's something interesting, interesting from a standpoint where it's uncommon. I don't know if you guys have any examples. I don't have anything coming to mind, except for I have one thing, and it's more along the lines of the overdose epidemic. And we have this happening very commonly now, where it's kind of showing that we're having more and more pediatric ingestions. Well, we don't even know if they're ingestions. They could be any types of exposures presenting with these kind of strange toxidromes that end up being an opioid toxidrome. And these end up being the crazy cases, because what you do is you get an urine drug screen and it comes back positive for fentanyl. And why is that happening in a 3-year-old, right? So, the circumstances of these exposures are unclear, really unknown. And there was actually a study that was published just last year through our colleagues at the Oregon Poison Center, and then they looked at national data kind of showing that this sudden increase in fentanyl exposures in this young population. And we don't necessarily know why. And to kind of tie it to this, and I think this is one of the more important kind of key takeaways in terms of harm reduction, is that the top driver of mortality in children in pediatrics are opioids. There are studies that do show this, and you don't just have to look at Poison Center data to prove that, but you also, would look at National Fatality Review data, and either it's usually pharmaceutical opioids are the highest implicators of fatalities, but a lot of times these come in as a surprise more than anything, which is kind of really kind of throws off providers when they are approached with these cases, but also highlights the importance of key harm reduction measures, whether it's drug disposal or provision of naloxone, even to this young patient population. So, hopefully that answered your question. I'm sure there are like other, interesting scenarios that we do come across that I bet Nikki and Lauren can also allude to.
Yeah, that was a really important point that you brought up, Anthony, that especially as pediatric practitioners, we want to be aware of and mindful of and keep it in the back of our mind when we're creating differentials for our patients who come in. But, kind of a lighter one that I remember was one of my first cases I took on the phone in the Philly Poison Center when I was a resident was a patient who had purchased suppositories for constipation, but they swallowed them instead of inserting them appropriately. So as pharmacists, it might seem like a really silly thing, but, we forget if someone has, is not well versed in over-the-counter medications or didn't get counseling, that's something that we get calls on. Not infrequently. I had some in fellowship as well. Fortunately, it's rarely harmful, but, it kind of seems striking to us as pharmacists that would happen.
I'm happy to chime in here as well with one other case that's not representative of one case, but representative of hundreds, and that's marijuana edibles. So to share a little bit of our data that we've published on this. So in 2015, our Poison Center had 4 edible marijuana cases reported to us. In 2019, we had 27. And in 2023, we had 332. So that's been a huge priority and advocacy and safety priority for our Poison Center. It's very tricky because in Philadelphia, we're surrounded by states where it is legalized, states where it's not legalized. It doesn't seem like we're seeing a strong correlation one way or another. However, what we do know is that whenever a product is made in a way that's attractive to kids are going to be kids. And it's always important for us to think about safe ways to package any product that could be attractive to kids. And right now, it looks like that is not happening consistently when it comes to edibles, but that's been a huge public health issue that we've been sounding the alarm on for the past 5-6 years plus.
Yeah, those are interesting. And that's something I've been tracking too. I've do a lot of research about CBD products, usage patterns, also perceptions of parents. And CBD as one of those marijuana products has skyrocketed in terms of calls. Now, it looks like maybe in the last year that's leveled out a little bit for kids, but it's still been a massive increase. So thanks for doing the work and publishing on your findings there. Another question that I wanted to ask about was some of the resources that you guys use as poison control experts. What are some of those go-tos that you rely on most? Now, before you answer, though, I do want to say my trainers at Nationwide Children's did a great job of telling me I am not trained to be a specialist in this area. You can go get some preliminary information, but you still need to call your poison control experts, right? Because you guys are going to guide us. But could you give us a little insight into some of those resources that you rely on most to help walk clinicians or parents or others through an exposure or an ingestion?
I think, probably one of the first things that we will do if it was a household product, a cleaner, a cosmetic item, is just look up the item ourselves. And so, I'm always confirming. They tell me the product. I do a search. I find, okay, is it the green bottle with the red writing and this and this? And then I confirm that I know exactly what we're talking about. And then from there, I would say our most commonly used resource is Poisondex, Micromedex. And so we're able to go into the product page and pull up the exact product, and then we kind of break it down by the components, the ingredients. And I typically start with what I'm most concerned about and then work my way through the rest. And then we're able to kind of gauge if we expect any symptoms, any toxicity based on how much was ingested or applied or whatever the mode of exposure was. I know for myself personally as well, I Gold-Frank's Toxicologic Emergencies is my tox Bible. I think a lot of toxicologists would agree with that as well. And then I also have my quick resource that was actually gifted to me by Anthony and Lauren and the folks at the Philadelphia Poison Center when I left for fellowship. So I have a poisoning and drug overdose book that's kind of just a little more abbreviated, easier to carry around, and good to find quick information. But I'm a big fan of micromedics. That's my biggest go-to.
Just going back to the idea of calling the experts when we're not sure, one of the things that I believe has increased over time as well is ingestions of multiple different products. And we may initially have a history thinking, oh, it's this one thing, but we have experts like the ones we're talking on here that can evaluate and say, you know what, this child's not perfectly fitting this toxidrome. Maybe there are other things we need to ask about or look into. And they're skilled in not only helping guide what to do next based on an exposure, but also teasing out whether there might be other factors to consider. So a pharmacist, if I haven't said it enough, don't hesitate to call these experts at our poison control centers. They can be massively helpful in navigating difficult scenarios when there might have been an ingestion or an exposure. Another question that we wanted to ask, and this goes back to some of the comments you've already made, is how can healthcare professionals, including pharmacists, play a role in educating families about poison prevention?
I know at least in the ER I work in, the hospital I work in, the Miami Poison Center is affiliated with our health system, so we kind of have a direct tie. But we have Poison Center resources on the counter that parents can pick up on their way out. So we have pamphlets with poison control information, the hotline number. We also have like basic guidance for our providers on, a review of toxidromes, things like that. So I would say from where I work in the ER at discharge, I can be jotting down the poison control number on discharge paperwork, or if they come in due to a concern of a potential overdose or tox exposure, I can provide that bedside consultation on how to contact the poison center and how to utilize them as a resource. I also am always encouraging my team, my attendings, the residents I work with, my learners to involve Poison Center in our cases. I always like to share my initial thoughts on cases we get, but we're always calling it in as well, not only to get more expert input, but to also have the data for our national poison database system that gets reported out nationally. Of course, it's all de-identified, but this helps us to better characterize our trends in ingestions and overdoses in children and adults. That's how we're able to identify that medical marijuana is on the rise, and that's kind of giving us impetus and legislators, the push to get better control of these substances that are affecting our children and our patients.
Amazing. And then just to round out, this is so informative and so fun to speak through all of these different scenarios. But just to round out today's episode, what are some key takeaways that you would like to give to either the parent, the provider, or the pharmacist that is taking the call or is wondering, should I have this child escalated because there's concerns for poisoning?
I'm happy to start off here. Something that I like to tell partners or people in our community is to never hesitate to call poison control. No question is too small. We're available free and 24/7. You're instantly connected to a nurse or a pharmacist with medical and clinical toxicologist backup. I think we like to say that we're free, but we're also very judgment free as well. I think people get very embarrassed or nervous to call us, but we've heard it all before. So whether it's saving our number to your phone for yourself, or if you're a provider, just reminding your patients that we're a resource. I think something that people also don't think of when calling us is to call us for basic medication guidance too. Once I actually called because I had a family member who was dosed or they're prescribed to take both acetaminophen and ibuprofen. And I didn't understand when I was reading the label, what that meant, how do I safely space these out with my family member? And I ended up calling the poison center, and one of our nurses said, oh yeah, this is what they meant. And this is how you can safely have the patient take both. So that's my takeaway, but really interested in what Anthony and Nikki have to say.
I think a good reminder to, we mentioned this phone number many times, but I'll say it one more time, 1-800-222-1222. It does link you to your closest poison control center, but there are 54 poison centers across the United States right now. So based on geography, you should be linked to the nearest person. But what I'll say is, the big key takeaway for me is prevention, and prevention is key. Whether it's reviewing with your parents, caregivers, the 5 or 6 rights of medication administration, right? Or also proper methods of drug disposal. Because if you get rid of the potential exposure, the exposure is not going to happen. And then I already mentioned the role of opioids in pediatric mortality, really, in the setting of poisoning. So knowing that naloxone, it's a wonderful harm reduction measure, not just for our adult population, but also for the pediatric population, which we don't always link to the opioid overdose epidemic. So I just wanted to throw that out there, that it's perfectly safe to give to children as well, in a lot of circumstances.
Yeah, I would say Lauren and Anthony really did a great job covering all the pertinent points there. But I'll say, if there are any pharmacy students listening to this podcast, the poison control number could be a question on your pharmacy boards. So remember, 1-800-222-1222. And, I think, like I alluded to earlier, if you're a parent calling because your child got into something, having the product in front of you will help us immensely. And I know we talked a lot about the aesthetic laundry room and how beautiful the clear containers are. But, even just keeping, if you choose to organize that way, just keeping those original containers, in the house somewhere, having photos, knowing exactly what is in the house. Childproofing the house is always important. You never know. You might think that something like this might not happen to you, but until it does. And a lot of the times, everything is okay, and we are so happy to help. But I think I just reiterate everything that Lauren and Anthony had already shared.
And Nikki, I can't resist. I have to brag on this statistic, on the great work of our healthcare providers, is that at our poison control center, 90% of the people who call us from home, we triage to stay at home. So we save people time and money and provide priceless peace of mind as well.
Well, those are great insights. And Nikki, just riffing off of what you said, yes, I'm a pharmacist by training, but I'm also a dad of 3, and I am personally thankful for you, Nikki, Lauren, Anthony, and all your colleagues around the nation, because I've had to call poison control for my own kids. Even though I thought I did everything to make my house safe, kids can get into stuff. So thank you for doing the important work that you do. I'm personally indebted to you and to your many colleagues. And again, thanks for keeping us all safe. We appreciate that. Thanks also for joining us on the podcast. This was fantastic. Mary, I feel like we could just keep asking questions for the next 2 hours, but listeners, I know we try to keep these to a place where you actually have time to listen to them. So Nikki and Lauren and Anthony, thank you so much for joining us. This has been really enlightening, and we appreciate your insights.
That's all for today's episode. Thanks for listening, and remember to subscribe on Apple Podcasts and leave us a review.